This presentation is about Alzheimer's and gender. It was originally supposed to be about Alzheimer's in men. But I found out when I was doing my research that there is very little known about the differences in men and women who suffer from this disease. Some of the greatest risk factors that both men and women share are increasing age, family history and genetics, past head trauma, and mild cognitive impairment. Lifestyle and heart health have not had a definitive link, but there are some evidence that suggests these same factors put you at risk of heart disease and increase the chance that you'll develop Alzheimer's. And these may include cardiovascular disease risk factors such as lack of exercise, smoking, high blood cholesterol, poorly controlled diabetes, and obesity. Also a diet that lacks in fruits and vegetables, and a lack of social engagement. Advancing age, family history, apolipoprotein E4, high blood pressure, head trauma and traumatic brain injury, mild cognitive impairment, social engagement and diet. Some of the things you will find in men is that they start losing track of seasons, dates, and the passage of time. If something doesn't happen immediately, they have difficulty understanding why. Men often forget where they are or how they got to some place. Other symptoms include putting things in unusual places, forgetting how to find them, difficulty in completing daily activities, forgetting recently learned information, and suffering from personality and mood changes. According to the 2011 American Alzheimer's Association report, of the 5.4 million Americans who have fallen victim to this awful disease, 38% are women, which means that the other remaining 62% are men. Gender affects how the disease develops and how it presents itself. Men tend to be more aggressive. They tend to perform socially inappropriate actions. They also wander more. But with all this aside, most studies have shown that men and women have the same risk of developing Alzheimer's disease onset each year of age. But despite all of that, women will bear most of the burden. Now, this may be because women tend to live longer than men, and they're going to survive longer. There are no drugs that will stop or slow the progression of Alzheimer's, but the USDA has approved 5 drugs that temporarily improve symptoms. And without the use of these drugs, Alzheimer's can benefit from active medical management of not only Alzheimer's but other dementias, and this tends to significantly improve the quality of life regardless of which stages of the disease the individual. These medical management techniques include the appropriate use of available treatment options, the effective management of coexisting conditions, the coordination of care among physicians, other health care professionals, and lay givers. This may be particularly important because most people who with Alzheimer's also have other health issues, whether they be cardiovascular, heart disease, lung diseases, high blood pressure, hypertension. There are myriad diseases, kidney diseases, that accompany Alzheimer's. Those who participate in activities and adult daycare programs and take part in support groups and support services such as counseling is also a part of the active medical management. death from Alzheimer's is currently a debate. It is more of a blur of death from dementia and death with dementia. Right now, it is currently the sixth leading cause of death among the elderly. And while the percentage of people who have Alzheimer's attributed to their death, while that percent is increasing, those percentages, the percentages of the other leading causes, are declining, which makes me tend to wonder if Alzheimer's will at some point pass things such as cancer, heart disease. But the increase of number and proportion of death certificates listing Alzheimer's reflects a change in the patterns of reporting the deaths, as well as an increase in the actual number of deaths attributed to Alzheimer's. And the complications from Alzheimer's, such as the development of pneumonia, has been found in several studies to be most commonly identified cause of death among the elderly with Alzheimer's and other dementias. And again, this shows where it's talking about the blurred distinction between death with dementia and death from dementia. And regardless of the cause of death, 61% of people with Alzheimer's at age 70 are expected to die before age 80. Only 30% of those without Alzheimer's at age 70 are expected to die before age 80. We are also expected to see, it's projected that we will see a percentage in the population that will be diagnosed. And one of the largest areas in the country that will see a growth of the population that has Alzheimer's is the Pacific Northwest. And the projected range of growth is from 81.12% to 127%. I want to thank you for your time.